Hi, my name is Ashley Miller. I'm here at the Health 2.0 conference, and I have a special guest and award winner. Can you please introduce yourself and your organization, please?
Hi, I'm Lance Wright. My company is Life Over Addiction LLC. We've worked with people in the addictions field, specifically clients, as they transition from treatment back into the real world and helping them establish a life that they haven't had in a long time and navigate that in a healthy way. I believe it's an essential part of treatment that's lacking, and I'm grateful to be a part of that movement.
That is amazing. So, what inspired you to close the gap between addiction, that transition to healing, and then going back into the world and living a completely different life?
Well, 30 years ago, almost 30 years ago, I was in the same position. And for most of my life, up to 30 years old, I did not know how to live a productive life. I had a very bad childhood, grew up in a very bad neighborhood. The whole thing was a wreck. And it wasn't until I met somebody that understood that to help me learn how to grow up at 29 years old and discover what it meant to begin to build a life and understand what that required. Because a lot of people with addiction issues have never really been productive. And even if they have, that productivity has been challenged greatly over the years of their life. And when they get sober, they have to re-engage in life again. And a lot of people don't have that skill set or those tools. And they're also navigating a place where many of their relationships have been damaged, and they have to learn how to communicate in that from a place of humility and understanding. And I think I also, in working with the client, I work with families because they also have to understand what's going on so that they can gain more empathy and compassion.
I wanted to divulge a little bit more because I personally know what it's like to have addiction, to live with someone that has an addiction, and how that can change your life.
Yes.
What about the individuals that are highly productive but still living a very addictive lifestyle as well? Is it the same kind of dynamic, or is the treatment still very similar in how you would do that versus someone that has to completely learn how to be productive?
The difficulty is if somebody has, well, what would they call it, a functional alcoholic or addict, if there is such a thing, because addiction is defined by progressive consequences. And obviously, if I'm having a conversation with somebody, there's been some progressive consequences.
Mm-hmm.
And so we have to address that and how to mitigate that going forward. Nobody goes into asking for help for alcohol or substances if a problem doesn't exist.
That's true.
Even the most productive people, and I see a lot of them in the treatment community, at some point they might have had a successful career, but then COVID hit.
Mm-hmm.
And we find in COVID, hundreds of thousands of people that were hard workers that used to go home and drink after work started eventually drinking at 10 in the morning because they're in front of a Zoom with their company and nobody knows they're having a drink. But then all of a sudden it's time to go back to work.
Wow.
And to go back to the office. And they're like, there's no way I can continue to do this. So they end up in a treatment facility. And for them, it may be just getting back on track. But for many people, we're creating a neural pathway. That's what addiction is. It's a reinforced neural pathway that's been practiced habitually. So when you feel stress, if you've drank for 10 years because of stress, when you feel stress, that neural pathway is going to fire and it says, I need a drink.
It's like in your DNA.
It's ingrained. And now we have to go back into that space together and work on creating new neural pathways. They call it neuroplasticity, to create a new option or a new choice in your life. That doesn't mean that those old choices won't be available, but you want to strengthen the new choices so that at least you have a better option and your odds increase by doing that.
And then you're more likely to choose to do that instead.
Yeah.
That makes a lot of sense. Also, congratulations for the accomplishments that you've made in receiving an award. So, with how you've impacted the health community and the big changes and shifts moving forward, how has your experience here at the Health 2.0 conference been so far?
I'm very grateful to be a part of Health 2.0. I've also been spending a lot of time in marketing because learning new generations like Gen Z and learning how to market to them in a 3-second attention span is a little difficult when you're talking about addiction. But also just in the healthcare industry, I'm learning a lot that there's a part of it where they discussed AI. And there's a big push to artificial intelligence and data. And I think those things are important, but on the panel I was just on, we discussed the need for the human connection. AI isn't going to have the conversation we need to have about helping you navigate this path. It can give us input and data, but it's not that personal relationship. So I think there's a combination of both that came out of this that I really appreciated.
I like how you stated that. It kind of brings to the surface how important it is for human connection and healing through addiction. So thank you for that. And within moving forward with being able to network, have this experience, what are some of the upcoming year, what are some goals that you have moving forward where you want to facilitate and continue rehabbing and conquering the addiction process?
Well, right now I just got done building a podcast studio / office. I'm going to be doing workshops for parents online because parents are all over the place, and I think they need the support just as much as the addict or loved ones for that matter. Also networking with facilities, building curriculums, increasing a presence. I don't think it's a matter of creating like the niche. It already exists. It's letting people know that we're there to help them navigate it.
I love that. And also, speaking of presence, where can the virtual audience connect with you online?
It'll be Life Over Addiction. I'm on YouTube, TikTok, LinkedIn, and you can also reach out to me through, I just came out of a session, so my brain's all over the place. My email at info@lifeoveraddiction.com. I'll respond. I really want to start conversations with people and expand what we do to help offset more hurt and pain in families. There's no need that people have to keep going back to treatment. Right now, and I just got challenged by somebody in the insurance industry that didn't really like it, but that's okay. The success rate for most people, and I say success is 3 to 5 years of sustained sobriety, may hover around 15% on a good day. If we're settling for that, then I don't want to be a part of that. And for those people that want to increase those numbers, I'm here. Let's start a conversation. Let's make a difference.
I love that. And let's end it on that note. It's been a pleasure. Thank you so much for what you're doing and your service to the world.
Thank you.
It has been wonderful being able to interview you.
Thank you very much.
No problem.